Yes. Okay. Number one, a BCBA is developing goals for a 10-year-old student who frequently leaves his assigned area, let me make it bigger, during independent work. The teacher reports that the student needs to make needs to make better choices, and the parent asks that he be more responsible. Okay. Direct observation shows that he leaves his seat an average of 6 times during each 20-minute work period. Which goal is written in the most observable and measurable manner? Let me make it bigger.
All right. The student will make responsible choices during independent work. No. Student will demonstrate improved classroom behavior across the school day. No. Student will remain within 3 feet of his assigned workspace for at least 18 to 20 minutes during independent work across 5 consecutive sections. Yes.
Yes, it is. Yes, it is C.
Yes,
Yeah,
that's it.
it is C. C is correct because observable, measurable goal with clear
Yes.
mastery criteria. It's not
Hmm.
A because responsible choices is vague. It's not B because improved behavior is too broad and not measurable. And it's not D because understand is a private event that cannot be directly observed. Beautiful. Okay.
Awesome.
No, number two, following an assessment, a BCBA determines that a teenager's property destruction is maintained by escape from difficult vocational tasks. The learner communicates using short phrases, strongly prefers brief breaks, and becomes frustrated when instructions are lengthy. The vocational supervisor has limited staff and cannot implement a complicated token system. Which intervention should the BCBA select?
All right. Clearly a complex token economy. No, obviously. Cannot the staff, it says the staff cannot implement a complicated one, so a complex token economy would not be good. So no A. For B, functional communication training for requesting brief breaks combined with task adjustments and reinforcement for task completion. Um, Maybe because it says the learner communicates using short phrases, strongly prefers brief breaks, and becomes frustrated when instructions are lengthy. So maybe B, let's look at C, response cost because the supervisor can apply it immediately. Um no, I wouldn't give a response cost. Um, and then an extinction alone, because it directly addresses the escape function. No, it doesn't directly address the escape. I'm gonna go with B.
It's B. It's B because it matches the behavior's function, learner needs, and available resources. So it's not
Yes.
A, not no A because it's too complex for available staff. No, it's not C because response cost does not match the identified function, and it's not D because extinction alone is rarely sufficient and ignores teaching a replacement skill. Beautiful. Number three.
Awesome.
Okay. A BCBA is asked to reduce loud vocal protests that occur when a child is denied access to a tablet. Assessment results suggest the behavior is maintained by access to tangibles. Which replacement response is most likely to be functionally equivalent and socially valid?
All right. So reduce loud vocal requests when he's denied access to his tablet. Suggest the behavior maintained by access to tablet. Okay, sitting quietly for 10 minutes. That's what's replacement response? No. Asking appropriately for the tablet or requesting information about when it will be available. Um, Maybe completing a handwritten worksheet. No, that's not functional. Taking 3 deep breaths whenever the tablet is removed. Also not functional. I would say B.
It's B because it provides an appropriate way to access the same reinforcer. Awesome.
Yeah.
It's not B because it doesn't obtain B. A, I'm sorry, it's not A because A doesn't obtain the tablet. It's not C because it's
Right.
unrelated to the function, and not D because it doesn't directly replace the communication need.
Right.
Awesome.
Why
Okay.
are you in my room? You had your own.
Number four, a BCBA implements
Okay.
differential reinforcement for appropriate requesting. During the first week, the same edible item is delivered after nearly every correct request. By the end of the week, the client begins refusing the edible and appropriate requests decrease. Which change is most appropriate?
Okay. Let me go through that one more time. Hold on. Um, the edible item after nearly corrected request by the end of the week, the client begins refusing the edible and appropriate requests decrease. Um, hmm, hold on. I'm not thinking straight. Hold on. Increase the size of the same edible after every response. No. Add punishment for refusing the edible. No. Conduct ongoing preference checks and use varied menu of effective reinforcers. That would be, I think, the most logical and most appropriate, or discontinue reinforcement because it is no longer effective. Hold on. By the end of the week, the client begins refusing the edible and appropriate requests decrease. Which change is most yeah, I would discontinue the reinforcement because it's no longer effective, but I would, to answer the question, but I would also be conducting ongoing preference checks and use a varied menu of reinforcers so that that doesn't happen, right? Does that
Okay,
make sense?
that makes sense. So now we have to pick the most
Appropriate.
amazing. Yeah, exactly.
Okay, so the first week, the same edible item is delivered after nearly every correct request. By the end of the week, client begins to refuse the edible and appropriate request decrease. So I would discontinue the reinforcement because it's no longer effective.
So the correct answer is C.
It is
Conduct
C.
ongoing preference checks and use a varied menu of effective reinforcers. I'm going to tell you why it's C. It's C because preference changed because of satiation. Very
Right.
reinforcers. Yes. Did you say
But
C?
then, but okay, so like that's a tricky question because which change is most appropriate? Yes, I would do C. I
Mm-hmm.
would be doing C, but
Mm-hmm.
wouldn't I discontinue that reinforcer,
Yes,
that edible?
yes, yes. So it could be C or D, and this is how the exam is. It
Oh,
could be C or D. So it's not D because reinforcement should not simply be removed.
oh, because it didn't say reinforcer.
Mm-hmm. Yeah,
Got it. Okay.
yeah. And it's not A because more of the same item may worsen satiation. And it's
Right.
not D because punishment doesn't solve reinforcer effectiveness.
Okay. I got it.
Okay.
Okay.
Number five, a BCBA plans to use extinction for severe aggression maintained by escape. Staff report that aggression has previously caused injuries, and the school cannot guarantee additional personnel during implementation. What should the BCBA do first? What should the BCBA do first?
Um, for severe aggression, maintained escape. Begin extinction. No. Evaluate risk, staffing, feasibility, and less intrusive function based alternatives before implementation. Add punishment procedures so the aggression will decrease faster. Tell staff to ignore the aggression. Okay, I'm going to go. Here's my thinking. I'm going to go with B.
B
Um,
is correct. It is B.
Yes,
It's
because I always want to take a look at everything in the environment and use the less intrusive first
mhm.
before any alternatives, especially with extinction,
Yes.
right? Like going right into extinction right away could, um, become a problem if there is an alternative.
Extinction
And
without planning may be unsafe.
yeah, like
Mhm.
it's right. And so telling staff to ignore the aggression, you can't. Like that's not
Mhm.
possible.
Mhm.
And adding punishment procedure so the aggression will decrease faster. Well, you
It
catch more
shouldn't.
flies with honey than you do with vinegar.
Exactly. Punishment should never be the first consideration. So it's not C and it's not A because we don't automatically add punishment. Beautiful. I love it. Yes.
Yes.
Yes, yes, yes. Okay. Let me scroll down. Number 6. A learner's screaming decreased substantially during treatment but returned several weeks after services were faded. Review of records show that treatment was used only in the clinic and caregivers were not trained. Which preventative step was most clearly missing?
Um, um, well then, so interesting. Screaming decreased substantially during treatment, but returned several weeks after services. Um, so it's like a relapse, right? Review of records shows that treatment was used only in the clinic and caregivers were not trained. Well, um, well, if caregivers were not trained and it was only used in one particular setting, which was the clinic, well, then there was no program for maintenance or generalization.
Mm-hmm.
So B.
B is correct. It's B because generalization and maintenance were not programmed. Beautiful. It was not A because more intensive treatment isn't the issue. It wasn't C because punishment wouldn't prevent relapse. And it wasn't D because less data wouldn't solve the problem.
Yes.
Awesome. Awesome. Okay. Number 7, a BCBA observes that a treatment plan is effective when she implements it, but behavior does not improve when classroom staff implement it. Direct observation shows that staff omit the prompting step in more than half of the teaching trials. What should the BCBA conclude?
Jesus, discriminative stimulus.
Yes.
Direct options, the staff omit the prompting step. Duh. So staff is not properly trained. Okay. In
Mhm.
more than half of the teaching trials. All right. So intervention is ineffective and should be discontinued. Not necessarily. The treatment effect cannot be interpreted confidently until procedural integrity improves. That's a possibility because there's no treatment procedural integrity.
Mhm.
Um, the behavior definition is probably inaccurate. No, because the direct observation of this that staff omit the prompting step in more than half the teaching trials, you can't conclude it because they did it sometimes. And
Mhm.
D, the client has failed to generalize the skill. No, it has nothing to do with the client. I'm going to go with B.
B is correct because low treatment integrity means results can't be interpreted confidently. It's not A because it may still work if implemented correctly. It's not C because behavior definition isn't the main issue. And it's not D because this is an implementation problem, not generalization.
Yeah.
Awesome. Amazing. Number 8, a treatment has been implemented with high procedural integrity for 8 weeks. Visual analysis shows no meaningful change from baseline, and caregivers report that the behavior continues to interfere with daily routines. What is the best next step?
Okay. Continue their intervention unchanged because consistency is more important than results. Modify or replace the intervention based on the data and, if needed, reassess relevant variables. Maybe. Stop collecting data to reduce staff burden. Has nothing to do with staff. So
Mhm.
definitely not C. Lower the mastery criterion so improvement is easier to demonstrate. High procedural integrity for 8 weeks. Visual analysis shows no meaningful change from baseline. I would go with B.
It's B. If you're listening to this, I promise she doesn't have the answers. It's B because data showed the intervention should be modified. It's not A because continuing ineffective treatment isn't appropriate. It's not C because never stop collecting data. And it's not D because review assessment before making arbitrary changes. Awesome. Number 9, a speech language pathologist recommends a communication method that differs from the method currently used in an ABA program. The BCBA believes the current method is effective, but has not reviewed the speech language pathologist data. What is the best response?
Okay. Honestly, you can't reject it because you haven't reviewed it. You're not going to adopt it because you haven't reviewed it. So A and B are an out. Let's look at
Mhm.
C. Review the rational and data, discuss client goals, and collaborate on a coordinated plan. Okay, that sounds plausible. D, continue the current plan without discussion. Oh, definitely not. You want to collaborate with other
Yes, yes,
professionals,
yes,
especially a speech language
yes.
pathologist. So C.
C is the answer. Collaborate using everyone's expertise. It's not A because collaboration is part of ethical practice. It's not B because don't change plans without reviewing evidence. And it's not D because ignoring other professionals is poor collaboration. Don't do that. Okay,
Yeah.
last but not least, 10. A parent asks a BCBA to reduce a teenager's hand flapping because it looks unusual in public. Assessment shows that the behavior is harmless, occurs mostly during excitement, and does not interfere with learning or safety. The teenager states that the behavior helps express excitement and does not want it targeted. What should the BCBA do?
Behavior is harmless, occurs mostly during excitement, and does not interfere with learning or safety. Behavior helps them express excitement and does not want it targeted. Um, but the parent wants doesn't like the hand flapping because it looks unusual. A, develop a reduction plan because the parent requested it. B, prioritize more socially significant goals and avoid targeting harmless behavior solely for appearance. C, use punishment only in public settings. Or D, teach the teenager to suppress the behavior whenever others are watching. Oh boy, that's a tricky one.
Mm-hmm, mm-hmm. Which one? What you gonna pick?
I'm gonna go with B.
B is the correct answer because we should target socially significant behaviors. It's not A
Yes.
because parent request alone doesn't determine treatment. It's
Yes.
not C because punishment is unnecessary. Don't do that. And it's not D because suppressing harmless behavior isn't socially valid. That
Yes.
was 100%. That was 10 out of
Well, I
10.
missed one. I missed,
Oh,
well, I sort of missed one. It was that
oh
one that I was like
no,
between those
no.
two.
You didn't
Yeah.
miss it because you said this or this. So
Yes,
technically,
I said this or this, and I could have gone with it, but then I was like, well, it didn't have, it said reinforcement instead of
Mhm.
reinforcer. But yeah, so that was really good.